We are so happy to have Maryam here. She is a leading oculoplastic surgeon, which is an eye surgeon. I'm very proud I managed to say that word, with a special interest in facial aesthetics and 15 years of experience. So we are in amazing hands today. She's also the founder of MZ Skin, which is a multi-award winning conscious skincare range that creates a hybrid between performance-driven formulas, blending potent ingredients and proven science with sumptuous textures and really nice packaging, which you guys will all have seen. You've got some lovely packaged products, hopefully in the post. And then she's also a creator and co-host of the Guinea Pig podcast, which is an uncensored discussion about safe aesthetic treatments with other people in the industry. So yeah, we have an amazing session planned for this evening. And with that, I'm going to hand over to Maryam, and she is going to take you through her products, and we're going to learn all about our eyes.
Thank you so much. I'm so excited to be here. I'm sorry I'm a little bit congested. I had my second COVID vaccination and it kind of floored me a little bit. So I'm going to be taking sips of tea every once in a while just to make sure my throat doesn't get too scratchy. So the importance of the eye, I wanted to talk about this a little bit before we delve into the products, because this is one of the first places that people come into my office complaining about. So whether it's tired eyes, puffy eyes, dark circles, fine lines and wrinkles, it's always like this part of the area. And of course, now with COVID and wearing masks all day long, there's more of an accentuation and, predomination of that upper eye or upper face area, which is the eye and the eyebrows. So it's become a little bit even more pertinent than before. And now in the time of Zoom and, video conferencing, we are so fabulous to have all of you guys here and to be able to share and, do work or whatever it is. But at the same time, it brings a little bit more emphasis also on the skin and particularly the eyes. When you look at someone, you spend 70% of your time looking at their eyes, then their nose, and then their mouth. And that's pretty much that triangle is where the eye usually tracks. There's some really interesting studies that have been shown to do that. So when I created MZ Skin, there were a few ethos and values and principles that I thought were really important. One was that I wanted it to be rooted in science. So, we have active ingredients that are tried and tested. It is not really, I'm not into fads or, different, moon dust and things like that. I really want ingredients that we know work well together. And then I wanted everything to be clinically trialed so that we know that they work in the combination in which we've used them. So if I say that I have this peptide and this is what it does, it's not because we know that that peptide does that, but because we've actually studied it in our own formulation. So I think those are sort of really important factors. We are, as transparent as can be in terms of ingredients. We have a really nice ingredients glossary on our website. So if you're ever confused about what a word means, you can look it up. We're free of all the nasties that, people predominantly know about and are worried about. And we are ethically and we're a conscious brand. So everything in there is for a reason. So, I hate when people say, oh, is it natural? Are there chemicals in there? So pretty much anything that lasts more than a week has some sort of chemicals in it. Otherwise, just in terms of preservatives, it wouldn't be able to have any sort of shelf life. But everything we've placed in our products is there for a reason. And so that's why I like to say it's a conscious and sustainable sort of brand in that sense. I also wanted, just because some people are vegan, there are 2 non-vegan products, but otherwise everything else. And even in those, we're free from animal cruelty. So everything has been sourced very ethically. And the idea behind everything that I want from MZ Skin is to reveal, enhance, and protect the skin. So what does that mean? So in the terms of the eye and the face always is to have a good cleanse. And that means that you use the Cleanse and Clarify. So this is a dual action AHA cleanser and mask. And what that means is that it has a dual function. Everything that I've done has been sort of multifaceted so that you don't need tens of products to do similar things. So you have the cleanser, it has these alpha hydroxy acids in it, which is a very nice and gentle way to exfoliate the skin. If you do not exfoliate your skin and cleanse your skin well, then anything you place on top might not penetrate as well as it should. So I have a clean face, but I'm not going to wash my face again for you guys on my masterclass, on this masterclass. But, you know, it has a clear, translucent sort of tinge to it, but it's fairly clear. It smells divine. It lathers a little bit, not tons. It's not meant to. And, you know, I don't love lathering products because generally it means that it's very stripping for the skin. So what this does is it gently uses different acids to exfoliate, remove dead skin, makeup, pollutants, anything that sits on top of the skin, and to make it really receptive to all the great ingredients you're going to place on top. So, you know, I love acids to do this, as opposed, there are different ways to exfoliate. So there's a chemical way and there's a physical way. Physical is, you know, when you, some of those beads that you might try. And I think those are really harmful to the skin because they actually cause, you know, micro-inflammation every time you use them. And some people are aggressive with different kinds of utensils. And, you know, you just have to be soft with your skin. You don't need to be over-aggressive with it. The beauty of this product is that you can use it twice a week and you get a deeper cleanse and exfoliation. It's almost like a very light office peel with all the fabulous AHAs that's inside of that. So, I mean, I really love this product, and I think most people who use it also really love it a lot too. So much so that we've been asked to make like a bigger size. You can use it as a mask twice a week. And then from there, if you're thinking about our ethos to reveal, enhance, and protect the skin, you've done the reveal. You've gotten rid of all the dead skin. You have a nice palette for all ingredients we're going to place on top. For the purpose of this masterclass, I'm so excited to show you our brightening and hydrating eye ampules. So basically, these are 10 ampules. There's one for the morning and one for the evening. If you forget, it actually is quite smart down here. It says day 1 a.m., day 2 p.m. And it comes with, so hopefully you've all now had a chance to wash your faces. And this one, you use the little cap protector, you break it off, and it's quite easy to do usually. Probably you have about a half they're all about half full, because this is actually just for the eye area. So I like to put it in my hand and to gently tap it on my lower eyelid as well as my upper eyelid, and it just feels divine. So within this, you have different brightening, brightening, plumping, and collagen boosting ingredients that really help to hydrate that delicate skin around the eyes, to help promote collagen production, and to also plump the skin. To be fair, there's a lot of solution or basically serum in this package. So I like to layer it on. And if you have still a little bit more, you can use the rest of it just on your face so you don't waste it. But the beauty of this is that it helps dark circles, it helps reduce puffiness, and it's just a really nice treatment for the eyes. Most people who use this see really an effect and an improvement just within these 5 days. So great if you have like a special event coming up. I also like using my middle finger because I think it's just like quite nice and you're not so aggressive with it. Also, I recommend you tap the eye going from in to out. This is a great way to improve circulation and lymphatic drainage in the eye area. And I would always remember your upper eyelid. People forget the upper eyelid, both in treatments as well as SPF. So never forget your upper eyelid. It's just as thin and just as delicate as the lower eyelid. So the beauty of this is that it's a short program. So you use one in the morning and then one in the evening on cleansed skin. It's the first thing you do. So remember, the most medicated after you've cleansed your face is the first product that you place on top of it. Then you build with serums. And then after that, you do the creams. And after that, you do oils. If you do it in a different order, then for instance, if you did an oil before your cream, likelihood is the cream won't then penetrate into your skin because that oil has created a barrier. So I think it's really important to, to remember that when you're doing your skincare routine. So I love this product. It has been amazing for everybody who's tried it. Next is our beautiful, fabulous anti-pollution eye mask. And this is really an excellent product. I'm going to open it up while I'm on with you. And so basically this has tetrapeptides, it has cotton stem cells, Lumices, basically a bunch of fabulous ingredients. Oh, let me show you what it comes in. I was going to put it on before I showed you. So it comes in this recyclable plastic, so you can throw this into your recycling bin. And you open it up, and there's basically 2 eye pads, and they're this fabulously gorgeous color of pink, shimmery. And you place them on your eye. It helps to prevent infrared, UV, and blue light damage, and it also functions to help hydrate the skin. So I don't have a mirror, but I think that's pretty close. Yeah, it's really close to the eyelid. I usually put for myself because I feel that I need a little bit more help on the outer ends of my lower eyelids. So I usually put the bigger version, bigger portion of it on the outside, but you can do either. And it's just cooling. If you'd like, you can place this into a refrigerator for about 10 minutes before you do the treatment. Mine has been just sitting at room temperature, and it's still nice and cold and refreshing. It's really a fabulous product. So it comes in a box that looks like this, pink, of course, hence I'm wearing pink. And you can leave it on for about 10 to 15 minutes. It will not dehydrate your skin. As I said, it's a great way to enhance your skin. You're giving it good nutrients to help decrease dark circles and help fight oxidative damage, particularly important in these times. I mean, like I said, we're on, conference calls constantly, Zoom, video calls, our phones are next to us. We have gadgets everywhere. We have computer screens. There's a lot of blue light that we're receiving. I think I've never taken more walks in my life than I have during this past year. So, just being outside and having constant exposure to the UV radiation, I think really important to make sure that you give yourself a little bit of TLC, especially in this delicate eye area. As I mentioned, it's the thinnest on the skin. It's about 200 microns, so really teeny, very thin, very delicate. Doesn't make the same oil glands that the rest of our face does, and therefore that's why you see the fine lines earlier on in those areas. Now, the nice thing about this mask, for instance, is it also helps decongest the area around the eye. So if you have puffy eyes, or if you've had a late night, doing whatever, or you've been drinking, or you had too much salt with your food intake, this is a really nice way to detoxify that area and make your eyes feel rejuvenated and clear. Have you put yours on? No. And basically, I just love this product. It's one of the go-to ones because it's really easy to do. I have 2 kids and I'm running around all the time, but sometimes if I feel like I need a lift, I just quickly put it on in the morning while I'm eating breakfast or even brushing my teeth. And it's just a nice way to be able to refresh and rejuvenate that area. And then you take them off and you toss them, unfortunately. So I'm going to take mine off. There's some really nice serum that's still in this. And basically what I do is, again, I just pat it and I just, put it all into my skin. Put it again on my upper eyelids. The serum that's in it will obviously also help the skin. And just tapping with this is really quite nice. Another instrument that you can use, I know you don't have it, but I thought I would just talk about it for a second, is either our gua sha or our germanium roller. So this is a roller that has germanium pods on it. Just very briefly, I just wanted to show you because these are really great acupressure points that you can use. So it helps in the lower eyelid to detoxify and also help lymphatic drainage. So you always go from the inside, no matter what gadget that you're using, from inside to out, because that's where the lymphatics go down into the neck. And you could use them also, on your forehead. I think one thing that I notice a lot in my patients right now is everyone is, well, I can't do it because I've had Botox, but they're frowning and they get this, the number 11s lines here because they're concentrated on their computer screen all the time. And actually using the tip of this roller is really nice because it really releases tension. You can use it in the temporals. People are also, I've had a lot of complaints of people with, grinding their teeth at night, particularly during this lockdown. So you can use it in the lower face and go in an upward direction to help give you a lift, but you can also use the top bit as a pressure point. Similarly, you can use the gua sha, which has nice cooling effect, which is really nice, but then it's got this curved tip, which we have, not us, but in general, we know that the gua sha stone helps to just pull everything back and, you know, go to the tip, go to your hairline, and it just releases tension. It just knows where those two marks are, exactly how it helps you. And you can use the bigger side and do that on your forehead. You can use it on your lower face, either with, you know, in between those two prongs, on the neck as well. So, you know, again, you can use this tip as pressure points in certain areas too. And it just feels like you've just had a massage, even though you've been at home. So you can add that sort of in anywhere that you'd like to. You can put it in the beginning of your routine or at the end of your routine. And then last but not least is our Soothe and Smooth. This is our eye cream, which is just divine. I'm just going to show you what it looks like. And this is perfect for dark circles, fine lines, and wrinkles. And so I usually put a few little taps on my lower eyelid, and then I massage it very gently into my upper and lower eyelid. So this is perfect. It has bark extract, it has hyaluronic acid, it has natural vitamins in the form of cacao oil. It's been shown to decrease fine lines and wrinkles by 10%, improve brightness of the lower eyelid by 50%. So really a power combination to really help to hydrate that delicate skin around the eyes. I also wanted to say that right now, you know, we're entering allergy season. I thought initially, if I didn't have the vaccine, I would have thought that I just have allergies, seeing that how, you know, how I'm so stuffed up. But one of the nice things about this Soothe and Smooth is that it will help decongest that lower eyelid area. So people have often heard of something called allergic shiners, and this is when allergies cause vasodilation of the very tortuous vessels, and we have so many of them in our lower eyelid. And so when they become tortuous, it appears like they're dark, even though you don't know that they're, you know, you think blood vessels are red, but actually they're blue and they're really quite dark. And so I think it's really important to remember that if you suffer from allergies, please make sure that you're taking your antihistamine or your nasal spray or whatever it is, because it really will help decrease that darkness around the eyes. Similarly, you know, doing some sort of either the gua sha or the roller around the lower eyelid will help decongest that blood and also decrease the appearance of dark circles. So dark circles can be caused by things like allergy, a lot of pollution or smoke, thin skin if you have a lot of dilated blood vessels, sinusitis, like what I'm basically experiencing right now. I have a little bit of darkness because of that. And then of course, there are other reasons for dark circles that will not be remedied by skincare. And that's, you know, if you have actual fat prolapse in the lower eyelid that causes puffiness and shadowing, or if you have, for instance, volume loss in your lower eyelids that actually accentuates the anatomical tear trough. So, but in terms of coloring, so if you can, the best way to know it is, you know, whether or not it's something that can be treated with skincare is that if you put cover up on it and you can cover it and you are happy, then it's something that skincare can help you with. If you cover it up and it's better, but it's still there, then it's likely that there's something more there that you need to see a doctor for. So that's sort of how I gauge it. If you're somebody who has puffy lower eyelids, I would not use Soothe and Smooth, because this is made for fine lines, wrinkles, dry skin, and dark circles. If you suffer from puffiness, then I would want you to use our Depuff and Define, which was originally formulated for the puffiness in the lower eyelid to help decongest that area. So I think it is important to know that there's a distinction, or you know, between dark circles, fine lines, and wrinkles, and puffiness. So I hope that was helpful. Gosh, that went by so quickly. Let's see. Some people have asked, is Soothe and Smooth good for the lower and upper eyelids? Yes, I recommend incorporating any eye cream morning and night. So you cleanse your face. The first thing you put on is your eye cream. Then you put on your serum and then moisturizer, SPF, or whatever it is that you're using. Very good question. Oh gosh, there's so many. Let me start from the very beginning. I'll see if there are any. how long do you leave the eye masks on for? So you can leave them on for anywhere from 10 to 20 minutes. On average, 15 minutes is a good amount of time. How often can you use the eye masks? You could use them every day if you wanted to, but on average, again, 2 or 3 times a week is a good amount of time. Roller, I love the roller, and the gua sha is coming soon. Oh, I'm sorry, I didn't realize that. Yes, if you have, if you're grinding, absolutely use your gua sha. It helps release that tension right here in your jaw. And actually, some people use botulinum toxin or neuromodulators basically to inject those muscles so that they weaken for a period of time. In some populations, they can make your face look quite square, and so actually using a little bit of botulinum toxin helps to slim the face a bit too. I heard not to use the gua sha over the filler or Botox. So that's untrue. You do not want to do a gua sha or any sort of massage or facial after you've had Botox or fillers. And that is not indefinitely. That is usually, like for botulinum toxin or neuromodulator, I usually say 24 hours. And for fillers, I say a week. Just, most of the time the filler is actually integrated in quite a quicker time. But if you want to be super safe, then I would say a week. But absolutely not. You can, in fact, I would say that if you experience, some people when they have their tear troughs done with filler, they can experience a little bit of swelling. And I, in fact, tell them to massage in to out, either with their fingers going in to out or using a gadget like the roller or the gua sha. So that is not true. I'm glad to myth bust that. Retinol. So retinol is an interesting and very powerful and potent ingredient. It is one of the essential products or ingredients that I think everybody should have in their skincare routine. What I would say is that when you're using a retinol, if you are not somebody who has acclimated or used it before, then I would recommend that you use a few drops of our retinol oil, for instance, 2 or 3 times a week for at least 2 or 3 weeks. And if you didn't have any side effects at that point, I would then say, you know what, you can increase it to nightly. So it is a very good product. It can make you dry, flaky, irritated if you use too much of it too quickly. If that's what's happening, try to be a little bit more cautious and do what you need to do, just as you're progressing. So if you're finding you have too many side effects, then, take an extra drop down or something like that, just till your skin gets acclimated. And it will. It usually takes anywhere from 2 to 4 weeks for that to happen. Let's see. Yeah, antihistamines. I'm actually taking some now. Let's see. Any other questions here? Oh, thank you. I think our eye cream has lovely texture too. If you have somebody who have puffiness and dark circles. So if you have somebody, so dark circles from puffiness is usually caused by shadowing. So you basically have like a little hill in your lower eyelid and then you have a valley. So no matter how much concealer you put on, you're still going to see the shadow effect of that valley. And so in that situation, I would use Depuff and Define, because those are the individuals who will benefit from the detoxification of that puffiness. And so when you detoxify that and it goes down, then the shadow of that trough or that valley just after it becomes less noticeable. So that's when I would decide I would use Depuff and Define. For dark circles, you're 29. You don't have dark circles yet. But if you're worried about dark circles, it all depends. So if you have, dark circles from all the things that I've said, then actually the Soothe and Smooth is an excellent product for you. If you have darker pigment in your skin, so for instance, you're Southeast Asian, or you come from a background of darker skin, sometimes unfortunately that can be hyperpigmentation of the skin. And if that is something that we're treating, none of these will be enough for you. I would still use a Soothe and Smooth, but I'd probably come in to see me or another doctor so that you can have something more prescription strength to help lighten that skin. What do I recommend for crepiness of the upper eyelid? So actually, as we get older, we do become more crepey in the very delicate upper eyelid skin too. And sometimes it comes hanging down. If you'd seen me this morning, I'm so congested, I look like I had like a hood on top of my eyelid. it's gotten better now that I've been awake for 12 hours or whatever. So, and I used my roller to help depuff me. But really, and this is something that happens to everybody. It's kind of like having gray hair. Some people get it earlier, some people get it later. To try and prevent it from happening earlier, eye cream is really important, and so is SPF. So as I said, a lot of people forget to put SPF on their upper eyelid. And so, that's something that you should incorporate into your routine every single day. And that's why both of my moisturizers has an SPF of 30, just in case you don't remember. Now, in order to combat it otherwise, obviously the Soothe and Smooth is an excellent product, as are the eye ampules. So they will hydrate, they will help collagen boost, they will also help to plump up that skin, that delicate skin in that upper and lower eyelid. You can obviously make it look better. In terms of long-term, the whole purpose of all these treatments that we're doing is to prolong or give you the best skin for as long as possible. So, and then there is a point that, this is not enough and you may need to have another an office procedure done, or even surgery. Can you use the products after needling? So yes, that's actually a great question. So you can use all of our products after needling. In fact, I would recommend, it depends. If you want something soothing, you can use our anti-pollution mask. You can use our vitamin infused meso mask, or you can use our retinol. So retinol will just mean that you have deeper penetration and almost like a slightly like a light peel going on if you use the retinol oil. But you can use all three of them together. So you can microneedle, you can use the retinol, and you can also use any of our masks, our gold, pink, or red. What is best for under eye hollows? Oh, this is what I spend my days doing in my office. So when you have hollowing in your lower eyelids, it's actually quite difficult to volumize it. So the idea is, again, if you're using the Soothe and Smooth, you have the peptide collagen boosting ingredients in there, peptides, ceramides to lock in hydration, to make that skin feel more hydrated and therefore thicker. So anything that helps produce collagen is really going to be a great boost for that lower eyelid skin. Retinol is one of them as well. What products would you recommend for milia? Excellent question again. So milia is usually like an accumulation of some skin residues in that haven't been properly exfoliated. So a good exfoliation is really good. I would use the Cleanse and Clarify, use it as a mask. And if you have access to our Radiance and Renewal mask, which is also an AHA amazing mask that smells divine and just really clears out all those pores, that's something else that you can use. If you're prone to them, those are the things you can do to prevent. If you already have amelia, sometimes you need to have it just manually extracted. You can go to an esthetician or your doctor, and one of them should be able to help you. Using your example of makeup covers dark circles, then is something skincare can help with? Yes. So if you can cover up your dark circles with makeup, then it's usually either pigment on the skin, or it's something with underneath your skin that's actually making you have the appearance of dark circles. So that's where, the collagen boosting peptide eye cream is really awesome, the Soothe and Smooth, or you can use, and also, of course, these brightening and hydrating ampules. So those are the things that are going to help you the most. I would also, if you don't even know if you are allergic or anything like that, I would recommend trying an antihistamine, because a lot of times people have underlying allergies they don't know about. And once they do it, they're like, wow, I mean, things just changed immediately. So I think that's also something to think about. What treatments would you recommend for fine lines underneath the eyes? So this is the bane of my own existence. I wish there was a great answer for this. We have lots of in-office procedures. So, honestly, it is prevention, prevention, prevention. So as I said, reveal, enhance, and protect. Don't forget to protect your eyes. It's so delicate. Once the damage is done, it's really hard to reverse. Of course, you can do different things. You can do lasers to help collagen boost. You can do CO2 to help collagen boost. You can do radio frequency. You can even have eyelid surgery. But those are all like substantial sorts of treatments. So I would always say, do everything to help build your collagen. You can use the LED mask even, which is really nice. It helps to rejuvenate the skin and produce collagen. Also helps decrease inflammation in the area. Like, you can use that after a peel. You can even use it after surgery to help the healing process. So again, I just think it's just really, you have to keep working on it. It's kind of like, I know I use this analogy of being in the gym, but like, you can't just work out once and say, where are my muscles? It's like a constant effort. Or you can't dye your hair and be like, oh, my grays came back, so it's the same sort of thing. You have to be consistent. Remember, skincare takes anywhere from 4 to 6 weeks to start seeing the full difference. And, just stay consistent. The best skincare routine is the one you can maintain. So I've tried to keep it simple so that you can keep it consistent. Is there any way other than fillers to treat under eye fat prolapse or perhaps make them look better with facial products and exercise? So using our Depuff and Define, you can help decrease the appearance of that puffiness in the lower eyelid. Actually, filler is not the gold standard. Having a lower eyelid blepharoplasty or surgery to remove fat and or skin is really the ultimate goal. Once it's done once, you don't do it again. So it's one of those really nice treatments to depuff that area. You can use fillers sometimes to mask it. But again, it's either, you help drain, you keep things so that you don't have too much, puffiness in that area. You can use, the rollers to help detoxify that area. And then finally the Depuff and Define. When not to use hyaluronic acid. Well, hyaluronic acid is kind of in everything. It's in all my products essentially. And it's basically a sugar molecule that is used to hydrate and provide hydration to the skin, either locking it in or keeping it superficially. So a lot of products nowadays have it. I would say, if you're somebody who's prone to getting puffiness in your lower eyelids, hyaluronic acid is probably not the best product for you because it helps lock in hydration and moisture. And if you're already prone to being puffy, well, you don't really want to have that. So there's really no time not to use it, but I wouldn't use it particularly around the eye if you're prone to having that puffiness. What are my thoughts about Morpheus 8 for under eye treatment? Morpheus 8 is a microneedling device with radio frequency. And basically what it does is that it delivers energy beneath the skin surface through these needles that penetrate your skin. They're usually 2 treatments done 1 month apart from each other, really great for tightening of the skin. And also obviously microneedling will always stimulate collagen production. I love this product. I use it, or this machine. I use it often in my office. I use it on the face. I use it on the neck, the décolletage. I've used it on bums, arms, knees, you name it, I've done it. And it's a really nice way to very gently firm that skin in the area. I like it also in the eye area. So yes, you can use it. I usually, when I do it, I don't do it in one specific area. I kind of do it in lots of different areas. So I figure if you're going to have the downtime, because it does have, anywhere from 3 to 7 days of downtime, you might as well have the best outcome for the entire face. The LED, is the LED mask okay to use when you have melasma? Yes. So, melasma is basically a condition. It's a pigmentary condition that's caused or exacerbated by anything that produces heat. So exercise, fireplace, being too high up in the mountains and sitting in the sun, having a sauna, and then also, of course, UV radiation. And it's often seen in women of childbearing age because it also has a hormonal component to it. People who are on oral contraceptives sometimes have worsening of their pigmentation. And you should be looking at ingredients that have azelaic acid, that have vitamin C, that have kojic acid, that have arbutin. These are all the things that are really good for the skin and for the lightening and brightening of the skin. And of course, SPF is an insanely important, important factor in terms of not worsening your pigmentation. You can use the LED. You can either use it on red or green. It will not worsen your melasma. So are there any in-office treatments for green circles from the inner eyes to the eyebrows? Inner eyes to the eyebrows. So up here, that is a harder area to treat. I often treat it with topical prescription medications. There are some people who have very large blood vessels in those areas. And if there are blood vessels, I can use a laser to treat that, yes. I'm thinking of having all therapy. Would you recommend it? So all therapy is not an eye. Well, you can use it around the eye. I don't really love using it around the eye, but it's a really nice treatment. It's an ultrasound treatment that uses ultrasound waves to deliver energy in the form of ultrasound waves deep beneath the skin's tissue without any downtime to help tighten. It's great to give you a non-surgical facelift. It takes about an hour. I say it has 3 negative P's. It's pricey, it's painful, and you have to wait 3 to 6 months to see the final result. It's really great for those people who are very heavy and jolly here, have this bit underneath their submental area that's very annoying. So yes, I think it's a really great treatment. I use it. I think it's the next best thing to a lower facelift, not in the same category, but close, a far second, I should say. How would you treat dark circles if eye creams are not working? So honestly, it really depends on your presentation. There's so many different reasons. Like I said, you could have puffiness, you can have dark circles, you can have skin irregularities, you can have pigmentation from UV damage. So it really would depend on what I see, but I would give yourself like 6 weeks with some good creams and see where you are from there. And let me see, are there any more? Did I miss anybody's questions?
Yeah, if anyone has any more questions, please feel free to add them in the chat, or if you want to ask Maryam live, you can come off mute and ask her as well if you're comfortable doing that. No one's brave enough. But
I'm
yeah,
not scary, guys. Ask away.
She's an expert. She can answer every single question you possibly have. Come on, everyone. But yeah, feel free to, we'll give it a few more minutes and see if anyone has any further questions for you.
And I wanted to say too, if you, if at any point you have any questions, you can find us on MZ Skin Official on Instagram. You can email to us. Oh, and I forgot to say that we have, for all of you guys, we have GTG 15. So this is a 15% discount, excluding the LED, until April 15th, just for you guys who've done this masterclass with us. So as a way of thanking you. So that was G as in get the gloss, GTG. 15, so you can have that as a little gift from us. Let's see, I did see something here. What age do you recommend starting with filler for dark circles, please? I do not like any question that has age. When you find something that bothers you, it doesn't matter if I used to think like there was an age limit or an age starting point, but then I started seeing patients who were quite young, who actually had things that were bothering them, impeding them, making them less confident, interfering with their, work life, their happy social life. And so I say, if something bothers you more days than not, regardless of your age, and there's something that can be done to fix it, then you should absolutely fix it. There is no reason, do your research, find somebody you trust and that you think was going to do a good job. But if you need it for yourself, and 99% of everything I do in my office for anybody is for them, not for somebody else. It's not for a spouse, a partner, a friend. It's for you. So if something bothers you and, somebody can give you a good outcome, I don't see why you wouldn't want to do it. So that's my 2 cents on that. I've heard that filler can stretch the skin, so it might not be great to start too early. So that would only be accurate if you're putting a lot of filler in your face. Now remember, 1 syringe is 1 ml, a tablespoon is 5 mLs. So if you think about it, 1 ml is basically, if you put it all together, it's like half a blueberry. So, if you're putting half a blueberry in a bunch of different places in your face, it's a very small amount. You will not stretch that skin. Most of us have, I'm embarrassed. I won't even do it. But if I tried to stretch out my skin, you could fit a lot of blueberries in there. So no, I wouldn't worry about it. The people who stretch their skin have used vials and vials and vials of filler. And there are some places culturally where people do that. So I had a training course once, and there was an instructor from, I want to say he was from Taiwan, and he was routinely putting 40 mLs in his patients to really contour them. And I use like a few at the very most. So it's very dependent on the practitioner. And so if you're worried, you can always say do less. I also wanted to say that while most fillers last anywhere between 6 and 18 months, there are some fillers that actually last for a really long time. Today I saw a patient, I did her tear troughs 4 years ago. They still look amazing. She doesn't need her tear trough. She's like, is it time yet? I was like, no, they still look great. So, you know, some people eat up hyaluronic acid faster than others. Some people who exercise, you know, a lot and have really fast metabolisms may eat it up a little bit faster. But, you know, if you're with somebody who has like a natural conservative approach, you never have to worry about that. What's the best way to treat dehydrated skin around the eyes? So again, as I said, what we talked about today is the perfect routine. You know, you cleanse and clarify, get rid of all the dead skin, pollutants, debris, reveal that beautiful skin, then enhance it. What are we going to do? We're going to use the eye ampules, plump, collagen boosting, hydration. Then we are going to use, you know, the eye masks, which are again, refreshing, hydrating, lock in hydration. And finally, we're going to use our eye cream, the Soothe and Smooth, which is going to lock in that moisture and help produce more collagen. So, you know, if you need something, give yourself a little boost, do this for 5 days and you will see a difference. If there's puffiness and dark circles, would the dark circles be most certainly caused by the puffiness? So the puffiness doesn't cause the dark circles, but what happens is that there's a shadowing effect. So you have that puffiness and then underneath it, you have that hollowness. So it's not that it's causing dark circles, it's just causing a shadow effect. So yes, if you didn't have the puffiness, you probably wouldn't have the dark circles. The reason I asked for the age cutoff is due to filler potentially stretching the skin. Okay, so you know, if you're using 1 ml and you're using half an ml between 2 eyes, which is generally, you know, what most people use, you are not going to have this effect. So this person has prominent eyes, still in their 20s, but worry that they're going to dramatically show wrinkles because they have such bigger upper and lower eyelids. What should she be mindful of to mitigate these signs? SPF is number 1, protection, protection, protection. Number 2, sunglasses all the time. Number 3, a hat. So the sun is going to be your worst enemy for sure, always. So make sure that you are well protected against UV radiation. Next, you want to have anything that helps thicken that skin and collagen. So again, something like Soothe and Smooth is an excellent product to use because it will build collagen and lock in hydration. Don't forget the eyes. People often forget the eyes because they think, oh, they're putting skincare in other places, so it's helping. The formulations made for eyes are made specifically to have better penetration because that skin has a different way of absorbing, slightly different than the rest of the skin, which is more porous, has little tiny hair follicles. So you need a slightly different formulation. The discount code is GTG15. So it's the, you know, get the gloss 15, GTG15. What is my favorite MZ skin products? I can't live without all of them, obviously. But actually I suffer from pigmentation. And so there's a few things. So of course, you know, the Soothe and Smooth for me, because my big things are my eyes. So Soothe and Smooth is one I can't live without. The cleanser lives in every bag and shower that I have ever visited. So I really need that. And Brighten and Perfect for me is you know, the product that, regardless of other things that I might be trying, because obviously we always have lots of NPD going on and I'm trying lots of different things, but I am so religious with my Brighten and Protect. I have the vitamin C serum always morning and night to help decrease pigmentation. We had amazing clinical trials with that. So basically we had a decrease in the appearance of pigmentation by almost 40% if used consistently twice a day for a month. So really, really fabulous product. And right now it's Tint and Protect and retinol, but you know, those are the different things that really I can't live without. Do anti-blue light glasses help? Yes, actually they do. So, you know, if you get those glasses, you can get special glasses on Amazon that are, you know, help you with screen time. And yes, absolutely. They will help decrease eye fatigue and periorbital aging from wearing those glasses. If you're somebody who actually wears glasses and have spent I say spent because most of the time, in order to have that UV protection, they're usually more expensive lenses. But if they've been formulated properly, yes, you can actually, even with regular glasses, prescription strength glasses, you can have improvement and protection from that UV. That's a great question. If you also are worried and you don't want to do that, there are some UV blue light covers that you can put on your screens as well. Profound treatment is very similar to Morpheus 8. I don't use the Profound. It's not as common here in the UK, and but it's very similar. I would always say technologies are not so much, it's not so much the machine that makes the difference, it's the practitioner doing it. So there's so many different machines for everything that we do and so many different kinds of filler, but it's really the finesse of the person doing the treatment that gives you the ultimate results. So if you find a good doctor or surgeon and they use Profound as opposed to Morpheus 8, that's okay as long as it works well in their hands. You can always email me. It's not difficult to get an appointment. It's clinic@drmaryamzamani.com. And let's see. Oh, great. So thank you, Claire, for writing what each of the boosters do. Would collagen supplements help? Honestly, the jury is out on that. So collagen supplements will not do you any harm, but a lot of that gets digested when you ingest food. And so it has to go through the normal digestion. It's not going to be harmful, but we don't have enough conclusive data to tell you whether or not it's actually beneficial right now. So no harm will be done, but if you think it's working, then it's worth doing. If only Soothe and Smooth, so if Soothe and Smooth is not a good option for you because you have puffiness, then I would recommend using the Depuff. And the reason we did this one is because most people have an excellent result with this, and very few people actually have puffiness from fat prolapse, unless they've been told sort of by a doctor. So you've noticed during lockdown that your eyes are quite dry and irritated. This makes me nervous about using cream. So is it actually the skin around your eyes or your actual eyeballs? So eyeballs are getting very dry because we're staring at screens all day long. So using some artificial tears, having a humidifier in your room, those are ways, making sure you blink. Those are ways that you can make sure that your eyes are well hydrated. If it's actually the skin around the eyes, Soothe and Smooth has been dermatologically and ophthalmologically tested, so it should be very suitable for you. If you're scared, try it, 2 days in a row, maybe in the morning or the PM, and just don't change anything else up. Try it independently. If it works, then if you don't have any issues or irritation, then it's no problem whatsoever. No, we have very few problems ever with any of our products, so I'm pretty sure that you'll have a nice result. So you notice that when using Soothe and Smooth after longer retinol use, sometimes it burns. So no, you can use the retinol around the eye, but if you're finding burning, that's because you're being too aggressive with the retinol. So you can still use the retinol. I always say, if you're using our retinol, put a few drops in your hands, rub it around and put it on your face. You don't actually need to go all the way up to your eyes, because if you put it here, it still migrates into that area. Remember, if you feel burning from putting a cream on, it's generally because you've taken too much skin off. So if that happens, maybe don't use the retinol for a day or two and then resume. Always listen to your skin. Any other questions? Are eye bags and puffiness the same? Eye puffiness and hollows. So eye bags. So if you're having confusion or you don't know, it would be great for you to come in and to see me so I can really definitively tell you. Puffiness is really when you have that contour abnormality. And hollows is usually, when you have a contour indentation as opposed to concave. So it depends. If you're having trouble deciding which one you are, you could always send a picture to us. I think we also, Claire, remind me, we have appointments. We can have virtual consults so you can see which eye cream would be better for you. The code should be working tonight. Am I correct, team? I think so, yes. All right, well, thank you guys.
Yeah, thank you very much. Thank you so much, Maryam, for educating all of our amazing masterclass attendees. But yeah, everyone seems to have had a really good time, and you've answered so many questions. Very happy.
Well, thank you so much for having me. I'm happy to come back anytime.
Amazing. And yeah, everyone, you'll be getting an email tomorrow with a recording of this class and a reminder of the discount code. And yeah, you should sign up for any future masterclasses with us. I'm sure we'll have Maryam back very soon.
Thank you so much.
Thanks, everyone.
Bye.
Bye.